So the question had to do with airborne pathogens, and it varies from pathogen to pathogen. For example, Staph aureus is rarely transmitted through an airborne mechanism, although we heard about the chickens in the hospital. If somebody has it in their nose and they sneeze right in your face, then sure. Or if they have a tracheostomy, sometimes we see patients with that and they have a lot of sputum and they cough and it sprays out everywhere. But by and large, the bacteria that we're talking about tonight, the multi-drug resistant gram-negative rods, the VRE, the MRSA, those are not transmitted through an airborne mechanism. Air handling is more important for airborne pathogens, like tuberculosis is the classic example, because somebody coughs or speaks or sneezes, and those particles are of a sufficient size where they'll stay suspended in the air and go outside the patient's room, and the same is true for some of the viral pathogens, many of which we don't see anymore, like measles, for example. Chickenpox is highly infectious like that. But most of the drug-resistant stuff, that's not an issue. For hospitalized patients, the big group are the immunocompromised patients, our cancer patients, our stem cell transplant patients. Those people can get fungal infections from the air, like aspergillus or something like that. And so those people need to be in a unit where the air handling is different, but it really doesn't have a big role in the drug-resistant stuff.